All right, welcome everybody to Finance 334. Tonight we're going to be talking about health insurances, and so we'll get to that in just a little bit. We're also going to be talking about group benefits and other employee benefits in a little bit as well. And that's chapters 15 and 16 from the text. So it should be an interesting evening as far as benefits are concerned and as far as information is concerned regarding insurance. Maybe one of the more topical conversations we have. Most all of us have to all of us mandatorily now should have health insurance in some way, right? Whether or not it's through Medicaid, through the state or through individual plan that we have or through work, all of us now are required to have it. So should be an interesting conversation and interesting topic for discussion on the discussion board regarding Obamacare. Obamacare is getting a lot of publicity right now, so it's very topical. Of course, I've been teaching this class for a few years, and right when Obamacare came out, obviously it was more of a firebrand issue back then. But now, with the renewals going on right now and the significant change in renewals as far as the premium costs going up, a lot of people are kind of re-upping that conversation. Of course, we've got an election next week, a new presidential election as of next week, and so of course that re-ups the conversation about Obamacare as well. So anyway, a lot of good information that we need to discuss tonight about health insurance. But before we begin, I wanted to take a few minutes and talk through the assignment from last week. I only got about a third of the assignments, which usually means, and this has been fairly consistent across multiple courses, multiple mods that I've taught this particular class on, and that is that a very low completion rate usually means that people get into it and just don't know how to do the math or don't know how to set it up, and so they kind of give up or get intimidated by it and don't do it. Those of you who listened or reviewed last week's session, those of you who actually read through the chapter covers it. They cover all three methods of formula, of coming up with the cost of insurance. We talked about it quite a bit in last week's session, and tonight I'm going to review it again. For some of you who already turned in the assignment, this will be a review. For some of you who already turned in the assignment, this will be a good review though, because for some of you, some of the math was off, some of the equations were off, and so this will be a good opportunity to kind of check your work again and then resubmit it for additional points if you'd like to. So we'll start with that. Then we'll get to chapters 15 and 16, and then as we always do, we'll take a few minutes at the end of class tonight to go over the topics that'll be on the test this week. The test this week will just have 10 questions, so pretty straightforward, pretty short, and shouldn't be too hard, but just over chapters 15 and 16. One other quick thing this week for the assignment is basically some short answer questions, more similar to the week one assignment, the life insurance assignment in week one. It's more similar to that, of course, this week being on health insurance, but just some short answer questions about different contract issues and premiums and deductibles and things like that regarding health insurance. So pretty straightforward. A lot less math involved than last week, and so should be one that you get done without any problems. So tonight, as I mentioned, I want to start off by kind of re-reviewing assignment 2 for those of you who are kind of hung up on it and feeling like it's pretty complicated and don't understand how to proceed. The assignment 2, I've got a copy of it on the bottom. It might be too small for you to see or be able to read, but basically it's a situation where we're trying to come up with the cost of insurance through a formula that the book gave us and also the slides gave us and also that we talked about last week during the session. But there are 3 different formulas depending on which one of these methods we're using, whether or not it's the traditional net cost method, surrender cost method, or the net payment cost index method. Okay. So first of all, one sec. Oh, let's go back. Sorry. Trying to move this down here out of the way for me. Yeah, the net payment cost index method. Okay, so I mentioned last week during the session there are 4 steps to each one of these methods. Okay, the problem gives you all the information that you need to know. Okay, and you just need to plug that information in correctly to the 3 different formulas based on which method you're using. Okay. The first method for the net cost method, the traditional net cost method, is you take the premiums, right? you minus out the dividends, the total premiums minus the dividends. Step 2 is you take that net amount and you minus out the ending cash value. That gives you a negative number. You take that negative number, you divide by the amount of years. Then you take that number and you divide by the amount of thousands. So in this particular case, we're dealing with 20,000. So you're dividing on step 4 by 20. Okay. One of the things that tricks people up is they get to number 2. Okay. Okay, they get to number 2 in the case study on number 2, and they still divide by the same numbers for 3 and 4, which is not how you do it. Okay, you got to look at the problem. If it's 20 years, you divide by 20 on step 3. If it's 20,000, you divide by 20 on 4. Okay, but if it's 100,000, you divide by 100. If it's 50, you divide by 50. Okay, it's just however many thousands there are that we're talking about as far as total death benefit. Okay, so that's how you do part A. Now, I'm going to give you the answer to part A so that you can check your work. The answer to part A is negative 0.39. Okay, negative 0.39 or negative 39 cents per dollar, or excuse me, per thousand of coverage per year. Okay, that's the cost per thousand per year for the insurance based on the net, the traditional net cost method. Okay. So now how do we do B and C, which are the surrender cost method and the net payment cost method? Well, these are a little bit different because as we mentioned last week during this session, and as you would have read in the chapter, these two methods start to account for time value of money. And it's important to account for time value of money. If negative 39 cents per thousand per year was accurate, that would mean that the insurance company is basically paying you to have insurance. And of course, we know that the insurance company is not paying us to have insurance. We're paying them. They're going to make a profit, so it shouldn't be negative, right? In reality. Well, what makes the difference? Time value of money, okay? Time value of money will switch those numbers and make those numbers a higher cost per thousand per year because we have to account for the fact that there is some value associated with money over time, right? Insurance companies know that. That's how they make a lot of their profit, is based on having your money over long periods of time and be able to grow it. Okay. All right. So how do we do the surrender cost index method or the net payment cost index method? Well, on the surrender cost index method, we switch things up a little bit as far as these steps. We still have 4 steps, but we're using a little bit different numbers. For the surrender cost index method, on part 1, we're taking total premiums and we're accounting for the time value of money. And so let's see, let me show you the problem. The problem says the annual premium is $248.60. Projected dividends over the first 20 years are $814. Cash value at the end is $43.14. If the premiums are vested at 5% interest, they will accumulate to $86.31. Okay, so that's the total premiums if we take into respect the time value of money, which we are when we're looking at part B and part C. So instead of using $4,314, which is the total premiums paid, we use the number $8,631 for part A, okay, as the premiums, and then you minus out the dividends at a 5% rate, which is $11.63 instead of $8.14, right? All these numbers the actual problem gives you and helps you account for time value of money without you having to do the math. Okay, so then we take 8631 minus 1163, and that's our answer to part 1. Okay, for part 2, we minus out the cash value again, and the reason we minus out the cash value again at 4314 and don't have to change it for time value of money is because that future cash value number is already a future value. It's already accounting for time value of money. Okay, so part 2 on part B is exactly the same, right? As far as what you're doing, you're minusing out 4314. But your net premium from part 1 is a little bit different because it's accounting for time value of money, right? So when you get to step 3, actually even after step 1, part B and part C of number 1 on the homework is going to change. It's going to be a different number, right? It's going to be a higher number. This time it's not going to be negative. I told you that the first one is negative. This one's not going to be negative. It's going to be a positive number per thousand per years. After we've done that, we divide by something a little bit different on part 3. Instead of dividing by 20 years, this time we divide by a function of how a dollar grows over 20 years based on time value of money. They give you that function in the problem again. You don't have to try to come up with that, but it's a little bit different way of doing part 3, right? Part 3 on this one, you divide by 34.719, which is what a dollar would turn into over 20 years at 5% per year. That's what we do on part 3. Part 4, we divide by 20 again because we're talking about 20,000. Okay, so those are the 4 steps when we're doing part B, which is the surrender cost index method. Now, when we get to the net payment cost index method, something changes, and that is that we take out an entire step. Okay. On part C, we don't account for the ending cash value at all. So we basically just take out step 2. Okay, so first step is the same as it was for part B. We take 8,631, okay, which is all the total premiums accounted for time value of money. We minus out the total dividends accounting for time value of money, which is 1,163. We get that net number on part 1, and then we skip to part 3. We don't do part 2 or number 2 when it comes to part C on the assignment. When we're doing the net payment cost index method, we don't account for the cash value. Okay, so this cost per thousand per year of coverage is going to be a lot more on part C than it was for part B or part A, because we're not accounting for the fact that we get cash value in this life insurance product. Then on number 3, we divide once again by that 34.719, which is again that function of time value of money for 20 years. And then number 4, we divide by, again, the thousands. So in this case, it was $20,000 of coverage, so we divide by 20. Okay, so that's how you set up each of the steps for number 1 on the assignment. You set them up the exact same way on number 2, but don't get hung up on number 2 by the fact that the numbers are a little bit different, right? You got to read through the problem and actually do the numbers associated with number 2. You can't just use the exact same facts and figures from number 1 or you'll get the wrong answer, okay? So if you get stuck on that, let me know, but just know that, you know, that's how you set these problems up, okay? And if you set them up right, you'll get the right answer because they already give you all the information. You just got to plug them into the right place, plug them into a calculator or plug them into Excel, and it will do the math for you, right? I'm not worried about doing the math wrong. What I'm worried about, and what I saw from some of the assignments that were turned in, and knowing that about 2/3 of the class still need to do it, that is that I think we're just not setting them up or don't know how to set them up. And if this wasn't clear, you know, if this wasn't as straightforward as you'd like it to be, go back to the book. The chapter does talk through each one of these methods and how to do them. And on top of that, not only does the chapter talk about it, but we also reviewed it last week for a few minutes during the session. And on top of that, I posted the slides, and the slides give you an example equation, you know, an example problem of going through these different methods as well. Elvira, welcome. Let me just mute your line so we don't.
How you doing, everyone?
Good. Good to have you. I'm going to go ahead and mute your line now. So you can use the chat box, Elvira. But welcome and thanks for being here. We just got done spending the last 10, 12 minutes on the assignment from last week. A pretty tough assignment for most people, and so I wanted to make sure and spend adequate time tonight kind of setting up what's required, you know, as far as setting up the problems for especially parts 1 and part 2, okay, for numbers 1 and 2, where you're going through those different cost methods and trying to do those calculations. I mentioned at the beginning of class, Elvira, about 2/3 of the class didn't turn it in. And the third that did, you know, some of the math we struggled with. And it, like I say, it wasn't the math necessarily, but it's setting up the problem correctly. And if you set it up correctly, you'll get the right answer because we're just plugging the numbers in, right, to a calculator. So we went over how to set those up correctly. I did grade all the ones that were turned in today. So you do have feedback on that. If you didn't get full credit, I've encouraged all of you to resubmit, you know, review, and then resubmit, you know, if you'd like some additional points. Don't have to, but that's always an option. And frankly, for most of you who didn't get 100% on it and set these problems up perfectly, that's okay. Don't worry about it. A lot of it's a challenging assignment for the beginning, and I would encourage you to just rework it. It's so easy to rework it, and it's worth the points, right, to get that done. So, yeah, I don't remember, Elvira, offhand on yours, but there were a lot of them that were close, but just not perfect, right, as far as the answers. So didn't get full credit, but still have the opportunity, of course, to review it, resubmit it, and get additional points after you've reviewed the first 10 minutes of tonight's session. Because I think if you really think through and review the first 10 minutes of the session tonight, you'll have the steps down and be able to set those up so you can get full credit. Okay? We talked a little bit already, Elvira, about what this week's assignment looks like. It's more like week one, just short answer questions. This week about health insurance. We're going to have a discussion board, of course, about Obamacare this week, so that should be interesting. And we're going to spend some time tonight about health insurance, and then we'll go over for the last few minutes the problems, the topic areas for the assessment for this week, which there are just 10. You were stumped on question 1 of assessment 2. Well, since you're here, Elvira, I'm going to review it with you. So if you'll give me just a second, let's talk about it. One sec. Let me pull it up. So question 1, assessment 2. It'll take me just a sec to get there. All right, Elvira, so question 1. So question 1 is exactly what we talked about tonight. It's just setting up the surrender cost index method. So you knew there were no dividends, but what tripped you up on that one then? Okay. So we can skip the dividends part, right? Which is that first part. You can skip that one. And all we have to do is take, let's see, annual premium was $12.78, cash value is $13.70. It's a 5% interest rate, so the future value of $1 deposited is 13.207. So one of the things that this problem doesn't do for us that is different from the assignment is that we've got to take that premium, that 12.78, right, times it by 10, but then we also have to account for 5% interest, right, because the surrender cost index method accounts for time value of money. So we've got to take that 12.78 times 10, right, which is $12,780. And then we have to put it into Excel or a financial calculator, like a Google, you can Google for financial calculator, and you have to make sure that that total premium becomes a future value number. Then when you take that number, and that's the math that it doesn't give you like the assignment does. The assignment gives it to you. The test required you to calculate it out, right? Which you don't have to manually calculate it, right? We just assume that you put it into a calculator, a financial calculator, or into Excel and calculate for future value. Once you've got that, though, the rest of it should shake out just fine. Yeah, you're fine. The challenge, and I think the problem with our setup for this week for the assessment was the assignment always gave you what the future value of the premiums was, right? They'd give you what the total premiums were, and then they'd also calculate for you what the future value was. Well, this particular problem just doesn't give you that. You have to actually do the calculation. But then when you go through the rest of the steps, you'd have been just fine. So tripped you up a little bit. Sorry about that. All right, then 25 problems. Well, and that probably would have more to do with spending a lot of time on the math, right? because if you spent a lot of time on those 3 math problems, that could have eaten up most of your time, and then you didn't, then you'd run out of time for the true, false, and multiple choice questions. So that's actually a really good exercise. And I should have mentioned this before the test, but one of the test taking skills that you've got to have, not necessarily for this class now from here on out, but for test 2 it would have really helped, is that whenever you have a math problem on any of your tests, skip that problem, right? Skip that problem and do it at the very end. And maybe that's what you already did, Elvira, maybe that's what you always do, but what happens is it creates anxiety and problems for the rest of them. And the rest of them, if you do them first, you'll probably still have 45 minutes left, right, by the time you get through those. And you'll have 45 minutes for the math. Then if you get 1 or 2 of the math problems wrong, you'll still do well on the test. But if you get, 5 or 10 of the true, false, and multiple choice questions wrong because you just had to rush through them, that's a problem, right? You can afford to get 1 or 2 math problems wrong. You can't afford to rush through a lot of true, false, and multiple choice questions and get them wrong. So this test was kind of an exercise in test taking skills too, because the math problem was number 1. So if you go through, just a test taking skill is to go through and do all the non-math problems first, and you only had 3 math problems on this test. So go through and do the other 22 problems first, right? And then go back to the 3 math problems. And if all you get wrong is the 3 math problems, you'd have been just fine, right? Because you'd had plenty of time to focus on the non-math problems and then go back to them. So anyway, that's doesn't help us at this point, I realize, but that's something that, for future reference for test taking, no matter where the math is in the test, just skip it, right? Come back to it. And well, I'm sorry that you had to learn it that way, though. I wish we'd have already gone through this or had this opportunity before. That should be like class 1, right? Online. The first one you ever take, they should go over test taking skills, and one of them is do the longest ones last. Do the straightforward true, false, and multiple choice first. Then you'll not ever run out of time. And if you do, like I say, if you just got 1 or 2 of the math problems wrong because you didn't have enough time for them, you wouldn't have been stressed out at, I think, at all, Elvira. I mean, you might have still been frustrated that you didn't have plenty of time to do all the math, but getting 1 or 2 math problems wrong wouldn't be, the end of the world. That's only, 8 points on the test. But getting a bunch of the true, false, or multiple choice wrong, that's frustrating. And I can understand where the angst came from if you were trying to rush through those problems because we took so much time with the math. Okay. All right. So assignment 2, like I said, from week 2, go back in, redo it if you need to. Should be in good shape, though, on that, because you can resubmit it, like I say. And then just know for week 3, everybody should be sighing a big breath of relief as you review this if you've already done assignment 2, because assignment 2 is pretty intense as far as the math on it and as far as the formulas and things that you had to know to get that right and set that up correctly. Assignment 3, once again, is more like assignment 1, where it's pretty straightforward, pretty simple. You just got to look up the information in the chapter, and you're in good shape. Okay, no problem there. Should be pretty straightforward. All right. So, any other questions about any of the other problems on the test, Elvira, since you're here, or anything about the assignment from week 2? I guess if you haven't reviewed yours yet, I wouldn't expect that you have questions yet, but any concerns or questions as you were going through it that you can remember from doing it? Okay. Well, let me know, and when you get a chance to review yours, obviously, let me know if there's anything that we need to do on that to help you out. I think the folks who turned it in, most of you got the gist of it right, but maybe just made a few mental mistakes as far as the steps are concerned. And so if you just go back and have more time, right, instead of Saturday night or trying to rush it at some point, if you have a little bit more time to kind of review it and think through it, I think you'll find your errors, if there were errors. I don't know for sure that there were, but if there are, you can find those really easily and then resubmit and get that extra credit. Okay. Let's move on for tonight's information. So you can see the agenda on health insurance is pretty extensive. We're not going to be able to cover all of that, obviously, but we're gonna have some good discussion on a few things, and I think it's helpful when it comes to health insurance. So first of all, health insurance in America has a lot of issues, a lot of problems. So as good as, some people, make this political, I'm going to try not to make this political at all, okay? Even though we've got an election next week, even though, generally speaking, Republicans think Obamacare has been a complete disaster, and generally speaking, Democrats think that Obamacare has been a big victory. I don't want to get into that. What I do want to talk about is, at its core, health care in the United States has some significant problems and issues to deal with, okay, that most people can agree on, right? We can agree on the problems. Sometimes it's how to solve it, right, that we don't necessarily agree. So a couple of the things that are significant. First of all, and perhaps most importantly, healthcare costs in general are rising very, very quickly. And there are a lot of reasons for that. It's not just the money-grubbing, profit, hungry pharmaceutical companies and insurance companies, right? There is part of it, right? Part of it is that insurance companies, pharmaceutical companies, healthcare, companies, hospitals, doctors, they require significant resources, right? So if a drug company is going to develop a new drug, they spend millions of dollars to do that, and they're going to recoup that and have to make millions of dollars more to develop their next drug. So drugs in general, pharmaceutical drugs, I should say, in the United States, all drugs in reality, but pharmaceutical drugs in the United States are very, very costly, and in part because pharmaceutical companies know they can charge it, right? And if they can, they will, because that allows them or enables them to research and develop the next drug, okay? So why do more drugs get developed and patented in the United States than anywhere else in the world? In part because a drug company gets paid the most in the United States to develop a drug. In many countries, if you developed a drug, you wouldn't be able to patent it. People would just copy it, and it would never get out. You'd never be able to safely test it. And so there are many countries in the world where drugs, new pharmaceuticals don't even get developed at all. And the flip side is, people would say, well, but it's so much less expensive to buy drugs there. Well, yes, but the flip side is they don't, their countries don't develop, pharmaceuticals at all, okay? Yeah, and there are lots of different reasons for that. There's not just one answer to that, Elvira, as to why, okay? It's a multiplicity of different things, and hopefully we go down the road a little bit tonight of discussing why. One is rising healthcare costs, though, right? And it's a mixture of a lot of different things going into that. Another, though, is the large number of uninsured in the population. When one person pays a health insurance company to help protect another person that doesn't have health insurance, that goes in to a hospital or emergency room and doesn't have health care, then everybody's health care costs are going to be higher. If everyone was covered, and this is the argument for Obamacare, if everyone gets covered, then there isn't this heavy burden on the people who are covered to cover the people who aren't. Because somebody has to cover them, right? We're not going to say no to them when they come into an emergency room, but somebody's got to cover that cost, and that cost ends up getting shared by the people who do have coverage, right? So if you have less uninsured, potentially you have less of a burden on the entire system, but there's still a significant segment of the population right now that's uninsured, okay, even after Obamacare. So we're going to go into that a little bit. Obamacare is going up significantly because of all these different things that we're talking about. It's a mixture of all of them. We can't just point at one of them and say, well, that's the reason it's the pharmaceutical companies, or well, that's the reason it's the insurance companies, or well, that's the reason it's because the healthcare professionals are making more money than they have ever made, and they continue to make more money than they've ever made, and increase every year. An orthopedic surgeon here in the United States might make $1 million a year. That same orthopedic surgeon, if he was practicing medicine in Mexico, might make the equivalent of $60,000 a year, right? Which, because of cost of living there, might be actually a really good living, right? That might be good money there. He might live like a king. But here, like I say, in the United States, working for a hospital network here, he might make $1 million a year. Now, we can disagree on whether or not that seems crazy. Like, why would we pay anybody that much money? But the system creates that, right? It's a system issue that pushes healthcare costs up and pushes salaries up and pushes CEO salaries of different pharma companies, insurance companies up. It's not just because we all sit around and decide that's what's going to happen. It's a system of markets, right? Here, if you're the best doctor anywhere in the world and you want to practice orthopedic or neurological or oncology, you name a specialty. If you're specialized as a doctor, right, and you're the best in the world, you come to the United States because you can get paid the most, right? That's just what happens. And so what happens is we get some of the best talent in the world, and the flip side is we pay them the most, right? And it's kind of, well, is it the cart before the horse or the cart after the horse? The reason that they come here is because they can get paid the most. The reason that they get paid the most is because of that same system that we're saying is faulty and is creating, these extra high costs. Yeah, and I completely agree, Elvira, because there are countries where doctors don't expect to make 10 times what everybody else is making, right? It's a situation where here in the United States, if you go to medical school, I think a lot of it has to do with if you're going to spend 10 years going to school and $300,000 in student loan debt to get through it, and some of the most rigorous classes and testing and hardest, coursework that's out there, they come out of that feeling very, they feel like they should expect, to make more than anybody else because of the work that they had to put in to become qualified to become that. Yeah, no, that's the worst part. Yeah, that's the worst part. I think sometimes the program to get you to become a doctor is so rigorous that the folks who really went into it for the right reasons end up coming out pretty hardened by it, hardened by the process, hardened by how hard it was, right? Just how tough it was. And they come out not being a caring healthcare provider. They come out being, I just got to make my money back and make up for all this lost time, going to school. So that's definitely part of it as well. Uninsureds are part of it. Uneven quality of medical care is a big part of it. A lot of times people will say, well, we should just cover everybody. The cost and expense of covering and providing localized health care to every single person in the United States is impossible. Okay, so we can start there, right? It's absolutely impossible to give every single person in the United States localized care. It's not impossible to get them care. And what we mean by that is if I live in, so I'm in Utah, Elvira. If I live in Vernal, right, which is kind of in the middle of nowhere in eastern Utah, and a state-run program is trying to give me care, I might have to drive an hour to go get it, right? Well, and that's a good point. Germany does provide free medical care, right? What we'd call like a socialized medical care, an Obamacare that covers everybody, a government care. So does Canada. But Canada and Germany are two very different situations, right? Because Germany is a very tight, small country geographically, so it's a lot easier to have centralized healthcare, right? You might have in Berlin the only experts in certain areas, right? But that's okay because everybody in Germany lives within a few hours of Berlin. So you can go and take care of that. But here in the United States, if all the best orthopedic surgeons all were in Chicago, that would be problematic for most of the country, right? Except for the people in Chicago, because we can't get over there, and so then you have a situation where you almost destroy the quality of healthcare based on the fact that you have to go somewhere far away to get it. A lot of studies have been done on Canada and the Canadian healthcare system, which is a government program, and a lot of people there love it, right? But most of those people are the ones that don't have to wait because they live in metropolitan areas that healthcare is really good. The rural areas, that's where it becomes very problematic and very costly to run a national healthcare system. It's just very costly. Putting clinics everywhere in the country to give everybody access, close access, is tough, right? It's very tough to do that. Very costly, as you can imagine. And then right now, point 4 is we have considerable waste and inefficiency. We, because of regulations, have one of the best environments for healthcare in the world, right? If we go into one of the nice hospitals here in the United States, and I realize there are bad ones, but if you go into one of the nicest hospitals in the United States, you'll get the best care that's available in the world. The flip side is we've got some of the worst care in the world in some, other areas. And at those best places, because of regulations on healthcare, which is a good thing, right? The regulation creates a high standard, but that high standard sometimes creates a lot of waste, just a lot of waste. Medical equipment, medical supplies, medical personnel. You have to have a lot of extra of all of that stuff to create a healthcare system that establishes a high quality. If you're willing to accept a lower quality, you don't have to pay nearly as much. So, yeah, I mean, and more ways than one, Elvira, right? I mean, not just in healthcare, but healthcare is an easy place to look at and say, yeah, I mean, it's crazy. If you talk to a nurse or a doctor at how much goes into just the quality of care, which we all want the quality of care, but none of us like the fact that it's so costly to do it and it takes so much. And you're absolutely right about Germany and any country who has nationalized healthcare. You give up quality of care usually, in part, right? Not access to care. Access to care gets better, but quality of care can come down a bit. And then the flip side of that quality of care issue is also the fact that you have to make up for the cost somewhere, right? You have to charge property taxes, sales taxes, income taxes, something to make up for not having the healthcare costs. Now, having said that, there are a lot of countries in the world that don't spend nearly as much as we do on education. They don't spend nearly as much as we do on defense spending. I mean, most countries in the world don't even get close to what we spend on defense spending. So, a lot of the argument that's out there is, redirect some of those fees and costs, and spending that we do to something like healthcare to make it better for everybody. And I don't disagree that there are probably ways that we could reallocate to make sure healthcare was better for everybody. Yeah, that's exactly right, Elvira. So if, what always surprises me is the same person who will fly to a Mayo Clinic in Chicago or in New York to get the very best quality of care. And, those doctors are making $1 million a year because they're the best in the country, or they're the best in the world, right? They're world-renowned doctors at some of those facilities. Those same people sometimes out of the other side of their mouth will say, we need to establish care for everybody, a high quality of care for everybody. Everybody should have access to that. And while I agree in theory, I'd love everybody to have access to those same best doctors, that doctor would not be in the United States practicing medicine here if we had a nationalized care system. That doctor would go to another country where they could get paid more, because nationalized care systems usually negotiate doctor contracted rates, right, and pay them a lot less than a free market system does. And so when we strip away what they're getting paid to lower the cost of the overall system, they'll just go to a different country and we'll have to fly to them instead of around the world people flying to us, which is what happens right now if you want the best care in the world. So, and it's not consistent, right? There are exceptions to that. There's great care in almost every country of the world and good doctors almost everywhere. But as a general rule, most of the world-renowned physicians are here in the United States because they can get paid the most. There you go. That's the American dream that's created kind of a mess when it comes to healthcare. and so we're having to eat the cake that we made, right? And we're all quick to complain about what we made and the problem that's here. But the flip side is it's got pros and cons, right? Con is it's so expensive. The pro is we've got access to some of the best quality of care and the best providers in the world. And if we're willing to give that up, then we could save quite a bit of money with our system. As a percentage of GDP that our country spends on healthcare, it's already 17%, and these numbers are really old. This is like 5 years ago. So you can imagine with Obamacare and the expansion of healthcare across the country, that number's gone up. And it really gets scary when you think about the fact that we don't even cover everything yet, right? If we were to cover everything, those expenses could theoretically even get greater. So what is that relative to other countries? Well, Germany, France, and Switzerland, which all three have nationalized care, Canada, which has nationalized care, United Kingdom, which has nationalized care, these are all nationalized care countries, and they're far less in healthcare spending than we are. Okay, so there's something different going on here in the United States. You know, even though we don't cover everybody, we're trying to. We're getting closer to it. We don't yet cover everybody every time. And yet we still spend a lot more. And this is back in 2008. This is 9 years ago, right? And 9 years ago, there was hardly any net, you know, for a nationalized plan. Now with Obamacare, we've got more of a net there to take on more. So when people talk about, you know, healthcare, you know, we don't spend enough on healthcare here in this country, that's not the issue. We spend plenty on healthcare. The issue is how do we provide it without, you know, significant waste, without significant rising expenses in healthcare. I mean, it's the how we do it, not what we're doing. We're definitely spending a lot on healthcare. It's just it's not maybe as efficient as it should be or could be to give more people care. All right, lots of different potentials, reasons for healthcare expenditures going up. We've talked about a few of them. We talked about how a lot of people were uninsured. This is back in 2007. That number's gone down significantly with Obamacare. A lot more people have insurance now. But there's still a significant element of uninsured people here in this country. Okay. A lot of people who are not here legally go uninsured, right? They're not going to get penalized through Obamacare anyway, so why would they, you know, go out and get insurance? And that number definitely will go back up. This year, you watch, Elvira, that the uninsured number will go back up a little bit because of the cost of insurance, right? If the average cost of Obamacare is going to go up somewhere between 20 and 35%, a bunch of the people who got on a few years ago because it was available and it was reasonable are going to pop right back off, right, with the cost this year. So it's a tough kind of going backwards a little bit when pricing goes up by that much. Why do people go uninsured? Well, you guessed it, it's too expensive, right? If it costs more for health insurance than it does for a mortgage payment, people go without health insurance. Yeah, and Elvira, that 327, I mean, I have people in my neighborhood that are paying $1,200 a month. And you know, it's insane, right? I mean, it's just not sustainable. There's no way that we can continue to charge what we're charging. It's a huge burden on companies too. You know, we always want to point fingers at corporate America, how greedy they are. But if you saw the amount of cost and expense that went to healthcare through companies that have to provide health insurance benefits, it would blow your mind. I mean, it's incredible the amount of money that our companies have to pay. Now, when companies have to pay that, what does that mean? Well, just all products and services cost more from that company because they have to recoup, you know, that money somewhere. So they just charge us more for everything that they do. Or as employees, they pay us less and give us less benefits, right? So if our company's having to pay a lot of money for health insurance, they might pay us less or give us fewer raises or bonuses or less, you know, benefits. That makes for a tough decision though, Elvira. I mean, that's not a decision that obviously anybody wants anybody to have to make, but coming up with the solution is really, really tough. Just is. Obamacare, I think, was a you know, here's me trying not to be political. I think it was a decent effort at trying to insure more people and trying to cover more people and make sure that people aren't going underneath, you know, and not being able to be covered. The problem is, you know, either, you know, it might not have been enough and it might not have been the right direction. You know, it's the how part that we get hung up on. Yeah, I think we have to, because going back to that uninsured piece just creates too much of a pressure and weight on the entire system. So any program that doesn't give everyone access, I think eventually will fail because of the weight and burden that those folks who don't have insurance will put on the system. Okay. Before Obamacare, a lot of the hospitals across the country were going bankrupt. Why were they going bankrupt? Because legally they couldn't not give care in their emergency rooms to everybody who walked in, but such a significant portion of the people who walked into emergency rooms were uninsured that they were losing money, significant money, most of the hospitals across the country. Now, post-Obamacare and some increases in Medicaid, they're starting to be able to collect, and hospitals are actually doing quite well right now. But that, once again, if people start going uninsured again, that will change, and we'll be back in the same situation we were before, where hospitals aren't solvent, and if they're not solvent, they start to close down in rural areas and in downtown areas or tough areas, and then they leave, right? And then it's a quality of care issue, right? If you live downtown Chicago and your one hospital in downtown Chicago has to close down because it's not making money, then your quality of life goes down because it might take you 30 minutes to get to the nearest hospital. And if it takes you 30 minutes to get to the nearest hospital, then we're talking about a quality of life, quality of care issue again. If you're having a heart attack or a stroke, you're dead, right? And I don't mean to be insensitive, but the further you are away from a hospital, the more of a risk, right, you run of a healthcare emergency creating a tragedy. So when these hospitals close down and we don't have close care, that can be a significant problem. And it's those poor, low-income neighborhoods that end up losing their hospitals sometimes. The wealthy areas, of course, are going to keep them because they'll keep their hospitals well paid. Okay, so we have just enough time for me to kind of introduce one of the things that's really important for this week, and that is how does insurance work, just basically. And this might be a review for you, Elvira. You might be very familiar with how insurance works, but for a lot of people, insurance is kind of a big mystery. How does it work? Why does it work that way? So basically, insurance has some key components, right? Perhaps the most important component of any health insurance plan is the deductible, right? Why is that important? Because the deductible is the amount of money that we have to pay out of pocket before the insurance starts to pay for us, right? And even after the deductible, there's usually a copay. Now, sometimes there's not, but usually there's a copay. So another important concept of insurance is a copay. Let's say we have a $1,000 deductible, just to keep numbers easy, we have a $1,000 deductible and a 20% copay. What that means is after we reach a $1,000 deductible with healthcare costs, then the insurance company is going to pay 80% of our healthcare costs, and we're going to pay 20% in terms of coinsurance. Okay, that's our coinsurance after we reach our deductible. Then another key concept of health insurance is your max out-of-pocket. Your max out-of-pocket is the number that after you pay that much, the insurance company will cover 100% of everything after that for the calendar year, but only for the calendar year. Insurance companies usually go year to year, right? So if you have a bunch of problems happen in December and you blow through your deductible is going to restart just a month later in January. And as unfortunate as that is, that's how it works, okay? So $100 deductible, $500 max out of pocket. If you have to pay more than $500, then your bills will stop. The bills will start being paid 100% by the insurance company. Yep. Okay. So no coinsurance. So a lot of people have a situation where, and I misspoke, there's copays and then there's coinsurance. Copays are for like doctor's office visits and things like that. Coinsurance is the percentage of the bills that the insurance company is going to pay after we reach our deductible. Yeah, I was going to say, Elvira, if you have a plan like that today, that would be very, very expensive. Most plans today have high deductibles. A lot of them don't have any copays, okay, unless you're already on Medicare. Medicare does have some copay plans, but most basic insurance now doesn't even have any kind of copay. So a lot of the plans now, in fact, I'm just doing my renewal through work right now for my own health insurance plan. My health insurance plan is $6,000 per person deductible. So I have four people in my family. I have to pay $6,000 out of pocket in medical costs before the insurance company will pay anything. Okay. Then after the $6,000, they pay 100% though. Okay. So the other thing is you usually have a difference between an individual deductible and a family deductible, right? Usually the family deductible is twice as much as the individual deductible. So if my daughter has $6,000 worth of expenses, I have to pay it. Then if I have $6,000 worth of expenses, I have to pay it. But then if my wife has $6,000 worth of expenses and we've reached that $12,000 out-of-pocket family maximum deductible, right, then we don't owe anything else. Now, with high deductible plans like mine, where it's a $6,000 deductible, that's also my max out-of-pocket as well. So they're one and the same, meaning I don't have any co-insurance after I reach $6,000. That's my max out-of-pocket and my deductible. Okay. Yeah, so that's where kind of the reality, the harsh reality of life comes in, right? Like your daughter, sometimes the only reason we have to have a certain job is because of the medical benefits associated with it. We just have to, because it's so costly to not have that, which is crazy, you know, that's what sometimes makes the world go round, but that's where we're at right now. That speaks to the problems with health insurance and the healthcare system in the United States at this point. Okay, so those are some of the basics about insurance. You've got deductibles, max out-of-pockets, co-pays and co-insurance. You've got individual deductibles, you've got family deductibles, and then, like I say, out-of-pocket maximums. Okay, so if you understand basically how that works, we'll get the math on both the test and the assignment this week right. If you need a refresher on it, the book in Chapter 15 covers it and goes through some example problems as well. All right, but that's all I can do for tonight on health insurance because we need to get to the topics for the test. So let me pull that up here real quick, Elvira, and we can give you at least the topics anyway, what you need to know for the test before you get to it. All right, number one on the test is a question. It's going to tell you a situation where somebody has a medical problem, right, or an issue. They have some medical bills that come, and it wants you to calculate what the medical, how much the insurer or the insured will have to pay. Now, be very careful on these problems where it's asking you to do these calculations, that you're answering what the question is asking. There are two scenarios on this test. One of them is going to ask you how much the insurer is going to pay. That's the insurance company. And the other is going to ask you how much the insured has to pay. If it ends with a D, that's the person, right? If it ends with an R, insurer, we're talking about the company, right? The insurance company. So when you calculate these out, just make sure you know what the question is asking it. So number one on the test is asking how much the insurer or the company is going to pay. Sometimes we read these problems and we just automatically assume, well, we'd always be asking what the person has to pay. That's not the case. This one's going to ask you how much the insurance company is going to pay. Okay? And we just need to know how to calculate deductibles and out-of-pocket maximums and co-insurance percentages. Those three things we've got to be able to calculate in order to get that one right. So if you need to, like I say, refresh or go through a few example problems in the book before you get to the test to feel comfortable with that, do it. Number two on the test. Is basic contractual provisions of health insurance. So if you read through Chapter 15, there's just some basic contractual features. For life insurance, we talked about how there's usually a 30-day grace period, usually a 2-year, suicide clause, usually standard statute of limitations, 2-year statute of limitations, right? So those are all consistent things with life insurance policies with some exceptions. The same is true for health insurance, not the same terms, but there is a group of terms that if you just familiarize yourself with that are very similar to the life insurance ones, but not exactly the same. But if you familiarize yourself with those, you'll get number two on the test right. Number three on the test Number 3 on the test, just know for number 3 on the test that the different types of coverages, there's what's called a first dollar coverage type policy. And really, in today's world, first dollar policies don't even exist. But first dollar policies where there are no co-pays and no deductibles are so expensive that it doesn't make sense for anybody to even look at them anymore. Okay, so just keep that in mind for number 3 on the test. But look through your different, your different types of insurance plans, and that will help you with number 3. But then just keep in mind what I just barely mentioned about the fact that first dollar plans are basically not existent anymore, but they're just not really relevant either because they cost so much money. Number 4 is another calculation for a medical bill. This time you're going to go from the customer's standpoint instead of the insurance company's standpoint. Number 5 on the test, you'll want to understand limited policies. There's something called limited policies, and we'll want you to understand the nature of those limited policies. Like, for example, cancer insurance or doctor visit insurance or hospital stay, insurance. Those are all limited insurance policies, and there are all kinds of different limited insurance policies. You'll want to be able to recognize the difference between those limited ones and then ones that are more traditional or standard. Number 6 on the test, just know the difference between an HMO and a POS, okay? A health maintenance organization and a point of service plan, okay? What are the basic differences between those? Yeah, interesting, Elvira. Aflac does a lot of those, what we call like restricted or limited health insurance, right? They'll do like hospital visit insurance, or they'll do cancer insurance. Aflac's probably the biggest one that people are familiar with, all the duck commercials, and they do a lot of different limited policies. High deductible health insurance plans, just basic features for number 7 on the test. So just read what the book has to say about high deductible health insurance plans. Number 8 on the test, basics of an HMO, health maintenance organization. What's the difference between an HMO and a POS? If you go back to that one, you'll get that one right too. Number 9 on the test, be able to define portability. What is portability when it comes to health insurance? And number 10 on the test, know the basics of group health insurance. And we didn't talk about group health insurance at all tonight, but there are some real basic differences between individual health insurance and group health insurance. You'll want to know what those basic differences are when it comes to group health insurance for number 10 on the test. And you'll get that one right if you're familiar with what those basic differences are. Okay? All right, any repeats, Elvira, on questions that you need a little bit more information on, or anything else we can do to kind of clarify what the topic is for each one of those problems? You got 60 minutes again this week. You've got only 10 questions, but you do have 2 math problems. So once again, good exercise in doing these tests, I think, would be to do the calculations last. Exactly. Go through, do all the other questions, and then just finish with those calculations so you make sure and not run out of time and have plenty of time to go through those. But if you've done a couple examples before you get to the test, Elvira, you'll be in great shape. You'll have plenty of time for this test if you've familiarized yourself with how to calculate, what would be the insurance company's portion to pay and what would be the individual's portion to pay. All right, any other questions or anything else I can help you with about the course? Again, thank you so much for coming. I know it's a sacrifice to come to these live sessions. I get to pick on you a little bit, and hopefully that's okay. You were very interactive, and I appreciate that. I think it makes it better for everybody else when they're listening as well to have that happen. So thank you very much. All right, have a great night. Have a good week. Let me know if you've got any questions or concerns as the week goes on, and good luck this week. Good night.